On this Friday night, we're about to finish out one of the darkest weeks in California history.
That's right. More COVID infections, more COVID deaths, and more COVID misery than any week since this pandemic began. Here are the numbers today. 52,000 new cases in California, the second worst day for new infections since the pandemic began.
And the death toll today reached 257, one of the worst days ever.
Let's go to LA County. A warning tonight for hospital leaders.
They are caring for so many COVID-19 patients. There may not be enough doctors or nurses to care for anyone who has a serious emergency like a heart attack, a car crash. KCAL9's
Chef Nguyen begins our in-depth coverage tonight with the latest from LA County.
Tonight, even lights and sirens would be of no help outside Queen of the Valley Hospital in West Covina, where ambulances were stacked up waiting to bring patients into the ER. From Sky 9, we watched as one patient waited for more than an hour in the parking lot. It's a desperate scene happening at all LA County hospitals. Our hospital system collapsing right before our eyes.
We're getting crushed. I'm not going to sugarcoat this. We are getting crushed. For most of the days of the last week, we have had 0 ICU beds open in the morning.
The Department of Public Health says 5,100 patients are now in LA County hospitals, which is an all-time record. ICU nurse Tolly Lee has cared for some of them.
How frequently do beds free up, and what happens when they do?
Our beds don't often free up, but when they do, they're either replaced with another patient, so there's never an open bed in our ICU. We always have somebody else replacing that bed.
If you have a heart attack, if you get into a car accident, if you fall off a ladder or have a stroke, we may not have a bed for you.
Doctors and nurses say staffing is limiting as well because many have been working 12-hour shifts day after day for months. So hospitals may be able to add beds, but they cannot always bring in more life-saving hands to deal with the increasing workload.
Just to give you an example, for an ICU patient, when we do prone a patient, which means we lay them onto their stomach, it's 6 nurses to 1 patient.
Which is why hospital administrators and frontline workers say they're frustrated with people who deny the severity of the virus and downplay its impact on hospitals.
I am terribly worried about everyone. This isn't funny. There's nothing funny about it. You don't know that this virus is depriving you of your oxygen.
Marcia Santini is an ER nurse at UCLA who got COVID. She's now pleading with everyone to stay home a bit longer as the vaccine is being deployed.
We need to take care of one and I can't talk. We have to take care of one another.
Public health officials say the surge we're seeing right now is from Thanksgiving. And they add the daily case count has doubled and at times tripled since then. In Hollywood, Jeff Nguyen, KCAL9 News.